Hello to those who are viewing this video today. My name is Dr. Nicholas Okumu. I'm an orthopedic surgeon. That means I'm a specialist who deals with bone and joint diseases. And today we want to have a brief discussion, just an informative video on sciatica. Maybe I'll start by defining what sciatica is. Sciatica simply refers to pain involving the sciatic nerve, which is a long nerve that passes from your back down the leg. And so when you're having pain that is related to that nerve, then we refer to that pain as sciatica. What are the symptoms that you can experience if you're having sciatic pain? The first, of course, is pain. It can be in the lower back, and the pain can extend all the way to the toes. So any pain starting in the lower back, extending to your buttock area, going down all the way to the toes, can be referred to as sciatic pain. Other symptoms that you can feel are pain in your hip joint, pain along the thigh, and also the calf and the toe region in isolation. So you can have pain in those areas without specific pain in the back. You can also experience a tingling sensation in your leg, or especially in the toes or along the thigh. You can also, with sciatic pain, have weakness in the leg because of essentially the pain is because of compression on the nerve. So that compression on the nerve can also result in weakness and difficulty walking, which is related again to the function of the nerve itself. So maybe also would like to know what kind of things could result in sciatic nerve pain. The commonest cause is a problem in the lower back, the area we call the lumbar spine. So there are different things that can cause pain in that area, but the commonest issue is usually a problem with the disc, what we refer to as lumbar disc disease. So your disc can slip into the area where the nerve is exiting and cause compression on the nerve, and that will result in sciatic pain. Sometimes just because of arthritis, which is the degenerative disease affecting the joints of your body, you can also get the nerve being pinched again in the lumbar spine. Sometimes you can also have a condition called spondylolisthesis, which simply means the bones have slipped over each other, and that causes the nerve to be kinked, kind of to bend, and that can also result in sciatic pain. Lastly, just a problem with your muscles, what we refer to as muscle spasms, can also result in an abnormal position of the nerve and result in sciatic pain. So in brief, those are some of the causes that can generate sciatica. If you're having this type of pain, then essentially what our first advice is, get assessed, because there are so many different causes and the treatment for each cause might be slightly different. So you need to get to see a specialist or a doctor who understands this condition, get the correct assessment in terms of examination and taking of a history, and then there are usually a few investigations that we can do to be able to determine the cause and the severity of your sciatic pain. Common tests that you might find us doing are things like an X-ray or an MRI. Sometimes we might do a test called a nerve conduction study to see how the nerve is functioning. And then in addition, we might do a few other tests to rule out conditions that might appear like sciatica. So for example, we could do X-rays for your hip and knee joint to rule out other problems like arthritis in those joints. Once the doctor has assessed you and understands the cause of your sciatica, then they can go on to give you advice on treatment. And the treatments can be as simple as resting, taking medication. Sometimes you might require physiotherapy, and in some instances we could give you injections, what we refer to as epidural injections, or blocks for your nerves. And lastly, at the very extreme end, we might require to do surgery. So, in summary, we have discussed sciatica. We have talked about what it is, which we have said is pain involving the sciatic nerve. We have talked a bit about what the symptoms would feel like if you have sciatic pain. I've also discussed the different causes for sciatica. And lastly, the most important point I have stressed is that when you have this type of pain, you need to see a professional, get the right assessment so that you can get the correct treatment. Thank you very much.